that I myself watch a lot of news, and obviously there's a lot of news about COVID-19, and but you don't hear a lot about trust in God, and that's one of the things that when we prayed the Rosary tonight, we asked for an increase in the 3 Christian virtues of faith, hope, and charity, and so those really need to be at the forefront and the foundation of us as a Catholic school system, right? Because we're not a government school, we're not a public school, and so we can and we need to and we want to be a very faith-based organization, not just for our tax-exempt status, right? But we really want to live that out. And so at the same time, we also want to be commonsensical about what's going on and really strive to know what the facts are for us here in Butler County when it comes to the coronavirus, and how do we best keep our kids and our staff and our families safe, while at the same time coming back to school here in the school buildings, because that's something that I think we really need. I think a lot of people really think that we need that too, for a lot of different reasons. One of the top ones being, I think, the mental health of our children and our entire school community. So, as I said in the letter from last week, a couple weeks ago, we as administration met with some of our local doctors here, Jim and Joe Witter, and Josh Seipel, and Rob Darrow, and also Leah Hayes. And so we've really had good conversations with them. They've helped us to give us some factual information about the pandemic, and then how to, along with Four Corners Health and the Diocese of Lincoln and the Nebraska Department of Education, and am I forgetting any other entities that we've been in contact with? Just trying to get, the CDC is another one, trying to get the best information we can for planning out the school year, so we can reopen in a safe way, but also in a practical way too, that's going to be best for our kids. And so last Thursday, Dr. Witter presented to our teachers about COVID-19, and was also taking some questions as well. And so she has graciously offered to do that for us again here tonight, for you parents, and also for those parents that are watching on our YouTube stream as well. But then if there's questions that you have for myself or Mr. McMahon, Mrs. Zook, we'll be happy to try to answer those for you tonight too. So I'd like to ask Dr. Witter now to come forward to give her presentation.
The purpose of this presentation, basically, like Father said, is to give you some background on what we know about coronavirus at this time, and the way that we came about putting together policies. When this all started in, January, and then in the United States in March, we didn't know a lot about COVID-19, and since then we have acquired a lot of knowledge. There are still many things that are unknown, but there are many things that are known, and so we need to use the knowledge that we have to put together the best policies possible, as opposed to, letting fear guide us. And so this is some background information. Basically, This one? So as far as the current pandemic, and these statistics that I have in here are as of like July 5th. When I put this together, but worldwide there have been, as of July 5th, there were 11.5 million cases of COVID diagnosed worldwide. There were 540,000 deaths reported worldwide, and in the United States, there were, as of that time, 3 million cases diagnosed and 133,000 deaths. Sorry. So how do those numbers compare to pandemics in the recent past? Basically there were 4 pandemics in the last century, and the worst of those by far was the Spanish flu, which killed 50 to 100 million worldwide and 675,000 in the United States. To put those numbers into perspective, when you take into account that the world's population in 1918 was 1/4 to 1/5 of what it is today, COVID would have to kill 433 million people worldwide. And like I said, it had killed, as of July 5th, 11 million, killed about 500,000 people worldwide. And in the United States, the United States population was about 1/3 in 1918 of what it is today. And so COVID would have to cause about 2 million people in our nation alone to die. And we're at about 133,000 deaths as of July 5th. So we're nowhere near, to those proportions. In Nebraska, COVID-19 there have been 20,000 cases diagnosed in Nebraska, about 285 COVID deaths. And again, I apologize, I didn't update numbers as of today or anything, but there were 285 COVID deaths in the first part of July, or up to the first part of July. 73% of COVID deaths in Nebraska have been in nursing home patients, and there's been 1 person younger than 20 years old that has died of COVID in Nebraska. There have been about 30 people die nationwide under the age of 15 of COVID. To put that into perspective, in 2018, there were 176 deaths of people under the age of 15 due to influenza. And the average deaths due to influenza every year during flu season of people under the age of 15 are about 125 to 175. And again, there have been 30 COVID deaths in the length of time of what would be a flu season. 60% of Nebraska's deaths have occurred in 3 counties, Douglas, Hall, and Dakota. Besides nursing home deaths, the other kind of epicenters in the United States, and in Nebraska, have been industry, so packing plants and factories where people work for long hours, close together side by side. In Nebraska, as of July 5th, 43% of the state's hospital beds were available, 53% of the state's ICU beds were available, and 81% of the state's ventilators were available. And those numbers have stayed pretty steady from March to now. Back when this all began, when they closed everything down and, closed schools and started having people stay home, the idea was we were going to do that in order to, quote, flatten the curve. In other words, we assumed that there would be the same number of cases of COVID no matter what we did, but that instead of them all occurring over the course of, 2 months or 1 month or whatever, and there being a big peak and coming right back down, the idea was we wanted to flatten that curve. We wanted to spread out the cases over a longer period of time so that the health systems were not overwhelmed. Because, of course, when the health systems are overwhelmed, people, there aren't ICU beds available, there aren't doctors and nurses available to take care of people, and there would be more deaths. Okay, so the idea of doing that was not to stop cases, not to decrease the number of cases. That was never the idea. The idea was to decrease the number of deaths by flattening that curve so that health systems were not overwhelmed. For some reason, the media has now put forth the idea that, we all still have to stay at home until there's no more COVID at all. And that was never the goal. That was never the plan. That is never going to happen. It's not going to happen that way. In Butler County then, as of July 5th, Butler County had 51 confirmed cases of COVID-19. I don't know what we're up to now, 56 or 57, something like that. We've had no deaths in Butler County due to COVID, and we have had 1 hospitalization that I know of for a serious COVID case. In our clinic, we've had over 40 patients test positive, not all from Butler County. Some positive tests were in people who didn't have symptoms and just came in to test because they needed to for work or travel, some other reason. In the vast majority of cases that we saw that had symptoms, by the time we called them 24 hours, usually 24 to 48 hours later, when we got the test results back, their symptoms were done. In the few cases that didn't resolve within that time frame, most were resolved in 5 to 7 days, certainly within 2 weeks. And those were very few that went on that long. So by far and away, people in this county that we've seen who have it have fared very well. And as far as symptoms go, the most common symptoms that we've seen have been fever, sore throat, loss of taste and smell. As far as the spread of coronavirus, it is not spread by wind or water. There's no spores involved. No, you can't get it through the skin. It's not fecal oral, and there are no animal vectors or mosquitoes, fleas, that kind of thing. It's basically direct contact, so face-to-face contact. And then at first there was a lot of emphasis put on indirect contact or contact from inanimate objects. So, you touch the table with COVID on your hand, and I touch the table, and then I scratch my eye and inoculate my eye with the COVID virus, and then I get it. And that's been shown to be much less the case than what was thought, for reasons that we'll talk about in a minute. Droplets, that's the major way, probably, droplets and direct contact. So the pathogen, the virus is on droplets that are emitted into the air when you cough or sneeze, talk, spit. The droplets, because they're heavy, fall to the ground very quickly. They don't hang in the air. And once they fall to the ground, they don't live very long off of a human host. Airborne, the virus can be aerosolized with breathing treatments and that kind of thing in medical settings. Um, Influenza is much more so spread that way. Um, and there's been a little bit more look into that recently, but I can tell you that if it were spread that way, there would be many more cases of it than what there are in less densely populated areas. For instance, measles is an aerosolized pathogen, and you can get the measles if you're not, vaccinated and haven't had it back before vaccinations. If someone with the measles walked into a room of 15 people, all 15 people would get it just by being in that room, just by that person breathing in that room. That is not the case with this virus. That is not what we're seeing. For every one person with COVID, you can estimate that 2 to 3 more people will get COVID if there are no precautions taken. And then again, fecal oral, not so much, or not at all, actually. So fomites and surfaces in a school situation. Of course, this is a big area of concern. We're always touching things. Again, there was a lot of discussion about the danger of this, but the CDC and WHO kind of stepped away from that a little bit as time went on. And worldwide, there have been no documented cases of COVID spread via a fomite or surface. And that would be a difficult thing to track, but with all the tracking that's done, there has never been a documented case that's been spread that way. And one reason for that is that it takes a certain number of viruses to produce disease in a person. Okay, if you inhale one virus, you are not going to get COVID. You probably need to inhale hundreds to thousands of the viruses in order to get the illness. On a fomite, that number of viruses, or fomite is just an inanimate object where virus can be. On a fomite, you're just not going to normally get that kind of viral dose off of a fomite. And when virus is left behind on inanimate objects by an infected person, that virus begins to degrade from the moment the viruses begin to degrade from the moment that they're left there. I know a big deal was made about the fact that, the Diamond Princess cruise ship, they came out with this big report that they recovered COVID virus 17 days after nobody had been on board of the Diamond Princess. They recovered the virus 17 days later. It was not virus that was recovered. It was viral RNA. Viral RNA is not infectious. Viruses are infectious. Viral RNA is just the virus's fingerprint left behind. It's viral dust. It's just proof that the virus was there. And then environmental conditions can help cause the virus to degrade faster in some situations. Wind, sun, and rain all cause degradation of the virus. And so, like playground equipment, it's just not that possible for enough virus to exist on those surfaces in those conditions to cause disease. In order to mitigate any risk that fomites might present, like in a classroom situation, we'll want to wipe down the frequently used surfaces on a regular basis, like at the end of a class or, so many times in a half day, that kind of thing. Things don't have to be wiped down every single time they're touched. One of the big things is, we need to keep our hands away from our face, remind kids to keep their hands away from their faces. And then you don't have to worry as much about the surfaces, but both cleaning the surfaces and keeping hands away from the face are the big ways of protecting our kids and ourselves from transmission through fomites. Unless you work in healthcare, gloves don't make any sense with regard to this virus. You're more likely to infect yourself as you take the gloves off and put them back on if you're not doing it properly. In primary grades, where maybe teachers will come into contact with secretions, they could use gloves to do that. However, if they handle the secretion and then they wash their hands, that eliminates any risk there. Quarantining items from when they're received from the store, mail, or other people is not necessary. Wash your hands after you handle them. Having the items sit there does not gain anything. You can wipe them off if you want. But again, if there was virus on those things, the conditions that they have to go through to get to you, mitigate that possibility. Limit sharing of items when possible, using reason. And if you wash your own hands and then wash the item off, that's sufficient as well. But if everybody has their own items, it just makes it a little bit easier and you don't have to keep reminding kids. So the main modes of spread are the personal contact, and then the droplet transmission. And as I said before, getting sick depends upon the viral dose that you get, okay? The dose of virus that you get through the course of a day depends upon the number of infected people with whom you have contact, the viral load of the infected people with whom you come into contact, and the distance that you maintain with the infected person, the length of time that you're with each infected person. And if you come into contact with more than one infected person, I put in a day, but really in any period of time, the viral load you get from each person can be added together to determine a kind of a total viral dose. Again, remembering if it doesn't make you sick, as it's not making you sick, it's also degrading. So it's not like 1 and 1 is 2. It's, there's a time factor there where there's degradation occurring. But this is one big reason why the number of cases and the intensity of cases in David City is so much less than in New York City, and different from Lincoln's. And Butler County is different than Colfax County, okay? Because all of these things are different. The number of infected people you come into contact with in David City compared to those other places is less. The viral load of the infected people is less. The distance that we maintain, is probably more because we're just more distanced to begin with. And then the length of time you're with each infected person, of course that varies. So if you think about someone in New York City going to work and coming home in a day versus someone in David City going to work and coming home, okay? You walk to the subway shoulder to shoulder with people in New York City. You get to the subway station and you're shoulder to shoulder with people, again, some of whom are infected. You stand in the subway car, and if you've ever been in the subway in New York City or a big city, you're standing in someone's armpit if you're as short as I am. And you are, very close to people for an extended period of time. And then you eat lunch in the city, and that's more people, and then you're back home on the subway, same route, probably the same number of people or similar. So through the course of a day, you can see how many people you would come into contact with unknowingly, and possibly acquiring somewhat of a viral load from, in each situation, as opposed to David City, where you drive to work in your own car, probably by yourself, stop at Subway or stop in, you get coffee, and you see a couple of people maybe, and lunch at Subway, where you might stand in line with 5 or 6 people. Maybe you'll get groceries after work and pass a few people in the aisles at work or at the grocery store, and then you drive back home again in your own car. Okay, there's no comparison to the contact as far as contacts go, and so you can see how the viral dose differs, in a metropolitan or a city situation versus a rural area. And again, the places, where we have seen the cases are where people are close together for long periods of time with maybe very infected people in factory situations. Nursing homes is another place where in some counties they had a lot of problem. With regard to kids, ages 2 through 18 and COVID-19, like I said, there have been 30 kids under the age of 15 that have died in the United States since this all began, as compared to influenza, where in the average year you'll have 125 to 175 kids die. According to the CDC, children under the age of 18 account for under 2% of reported cases of COVID-19 in China, Italy, and the United States. And it appears that with COVID-19, children are rarely, in fewer than 8% of cases, the first in a family to acquire COVID. So in other words, parents give it to kids. Kids do not typically bring it home to parents. Unlike influenza and other viral illnesses, oftentimes kids are the first to, or maybe the first to get it and bring it home to the family. One European study that looked at staff and students, and a lot of these studies are retrospective studies in European countries where they did not disband school right away. They, in France, Sweden, I think in England, and in Australia, school or kids, they did not stop school right away when COVID, hit their country. In 1 year, so this data all comes from there because in the United States we really don't have any experience yet with school and COVID. One European study that looked at staff and students at 5 primary schools and 10 high schools found that out of 863 people who were in close contact with someone with COVID, only 2 contracted COVID-19, okay? In a study of 9 students and 9 staff people infected with SARS-CoV-2 SARS-CoV-2 or COVID-19, in Australia, 2 secondary infections were identified among 735 student contacts. One came from a staff member and the other from 2 classmates. No cases were identified among 128 staff contacts. And then in another study, no secondary cases of COVID-19 occurred among 112 school contacts who were exposed to a 9-year-old boy with respiratory symptoms and was diagnosed with COVID-19, influenza A, and picornavirus. So, and I think this kid actually traveled between 3 schools, I read. And so he had 112 school contacts, and nobody else came down with COVID. Another concept that's kind of big, or that's been made, that people have been made aware of, the concept of symptomatic spread versus pre-symptomatic spread versus asymptomatic spread. Symptomatic spread is, of course, anyone who has symptoms, and anyone with symptoms can potentially have COVID-19 and spread it. The most common symptoms of COVID-19 include the fever, cough, sore throat, headaches, body aches, and loss of sense of taste and smell. Mitigation of symptomatic spread includes staying home if you don't feel well. A big thing to stress, and not giving penalties for staying home for being sick. And that kind of goes against a lot of America's work ethic, I guess. We drag on no matter how sick we feel sometimes, and that just needs to be discouraged right now. Parents need to check with their kids regarding symptoms, and then it would be recommended to take temperatures before leaving home. A lot of workplaces are checking temperatures as you enter. Of course, with any illness, you're not going to run a temperature 24 hours a day, so that does not pick out all of the sick people that might be walking in, but that's one way of dealing with it. It is thought that people who have symptoms probably have a higher viral load, and so they would more easily spread it than someone who has a lower viral load, so someone who's asymptomatic or possibly pre-symptomatic. Pre-symptomatic and asymptomatic spread. Basically, pre-symptomatic spread is spread of the virus from person to person before the infected person gets symptoms. So, basically you're sick, but you don't know it yet. And then spread of the virus from a person who is infected, but who never gets symptoms. We've all heard about the asymptomatic people who have tested positive. And it's thought that those people probably have a very low viral load, which is why they're not expressing symptoms. A pre-symptomatic person is more likely to spread infection than an asymptomatic person, again, because of the viral load that they have. Mitigation for pre-symptomatic spread is difficult. So the best mitigation is to recognize when you've had a significant COVID exposure. A significant exposure is defined as having close contact, so that would be being less than 6 feet from a person who has COVID for greater than 15 minutes, regardless of face coverings, with a person who goes on to test positive for COVID-19. So both of those conditions, significant, a close contact for greater than 15 minutes. It's not either or, it's both, okay? So the chance of walking by someone in a grocery store and getting COVID are pretty low. If you learn that you've had a significant exposure, the best option is to self-isolate until 14 days have passed since you had contact with that person. It is thought that people who are infected who never develop symptoms have a low risk of spreading the disease because they have a very low viral load. And again, that's something that has gone back and forth in the media. I can tell you from my experience, from our experience, from things that we've read, that's true. They have a low risk of spreading the disease. It's not zero, but it's low. It can add to your viral dose if you've come into contact with somebody else, with 4 other people who are asymptomatic, and you happen to come into contact with all of them in a day, but in a place like where we live, it's not as likely a scenario. You'll never know that you're asymptomatically infected unless you choose to randomly be tested. Or, like I say, people have come in because of work or travel. Children are not big spreaders of the disease, regardless of whether they're symptomatic, pre-symptomatic, or asymptomatic. They are not the drivers of this disease. Mitigation of pre-symptomatic and asymptomatic spread is the reason for the whole mask debate. The idea is, of course, that if you don't know that you have the infection because you don't yet have symptoms, or you're not going to have symptoms, so you're asymptomatic or pre-symptomatic, a mask will shield others from the droplets you may be shedding while talking or breathing, or simply breathing. The suggestion for masks does not apply to symptomatic individuals in social situations because symptomatic individuals shouldn't be there. If you have symptoms, you shouldn't be somewhere. I mean, masks are not for people with symptoms. That's not the idea behind them. It's the asymptomatic and pre-symptomatic. Masking has stirred up more debate and controversy than probably any other issue regarding the pandemic. The people who support it argue that it's everyone's responsibility to wear a mask to protect everyone, and the people who reject it argue that it's each person's right to choose whether or not they wear a mask, and that the threat isn't great enough to justify taking away the rights of others, or the rights of themselves, I guess. And for what it's worth, I mean, this very same debate occurred during the pandemic of 1918. You know, huge fights, debates went on. Basically, at Aquinas and St. Mary's, we're recommending masks as being optional for the reasons that I had outlined earlier. Children under the age of 18 haven't been shown to be very effective spreaders of COVID-19. So there's much less to be gained by masks in the classroom settings than in some other settings. Especially, again, in a community like ours, the CDC has said, that CDC and the health departments have said that, you know, we need to take into consideration the conditions in our community in order to come up with the policies. What's good for Lincoln, Omaha, whatever, is not necessarily what's right for us. And what's right for a smaller community is not necessarily what's right for us. So we've tried to take all of those facts into consideration. It's important that if you're going to use masks to mitigate disease, that they be applied properly. That's one of the problems. That they fit properly. Many times they do not fit properly. Many times people are wearing them on top of their glasses. So, the air that flows from your mouth goes out the path of least resistance, which is any pucker that's around, the mask. And so, if you do have the virus, whatever's coming out, is coming out all in one big shot, where there are holes in the seal. They have to fit properly. They have to be applied properly. It is very difficult to wear a mask all day long, every day. I mean, I can tell you that I am touching the mask somewhere often, at least probably several times in an hour. And, pulling it down in order to get a breath of fresh air, putting it back up, putting it under my nose. And I'm not the only one. I see it all over. And when you are touching the front of the mask, you're basically potentially contaminating your hands again, because anybody who has talked at you with virus, so the virus is on the front of the mask, or if I'm talking and it's coming out the front and I have the virus, it's all right there and I'm touching it and putting my mask up and down, and kids are going to be doing the same thing. And then studies show that if you can maintain 6 feet of distance between people or have contact with others for less than 15 minutes, that an asymptomatic person or pre-symptomatic person will not spread disease, regardless of the presence of a mask. Masks decrease classroom communication and understanding. Voices are muffled and facial expressions can't be seen and interpreted. It is fatiguing to wear a mask all day long. I cannot wait to get done and get the mask off my face. Some settings in school, may be appropriate for short periods of time for a mask. If you're working closely with somebody, with another student, with a teacher, they may be appropriate for short periods of time. if they're going to have close contact with someone for more than 15 minutes, absolutely the masks should be used then. And so basically, again, we just want to set policies that provide the most effective mitigation, so that we provide a safe environment for our kids while continuing to provide an environment which is most conducive for carrying out the business that we're here for, which is Catholic education. Setting the most reasonable policies requires some knowledge of infectious disease. There's a lot of emotion that's out there, a lot of feelings, and those things really are separate to the knowledge of infectious disease. And then taking into account what is known about the novel coronavirus. We have acquired knowledge about the virus, and we need to use that knowledge in order to set policy. We can't let fear be our guide with regard to this. The restrictive policies are not necessarily the best policies for our kids. And the big thing to remember is that we are living in an area with a very low rate of infection to begin with. And we don't have to behave in the same way that more crowded areas of the countries should behave. Children don't acquire or transmit the virus as readily as adults do. And so the policies for our school system, should be distinctly different than for other settings which involve more adult populations or more dense populations.
If anyone has questions for Dr. Witter or another one of the doctors, we do have a microphone. Okay, so whoever has a question, Dr. Witter can just repeat that. Yes, Laura?
And we've kind of work out the plan for the majority of the population here. I don't know, and I mean, it's not that doesn't have to be addressed or shouldn't be addressed or won't be addressed. I don't know if
Right. I think one of the things that we will do in each school building is have parents work with the building principal on what the parent and child are going to be comfortable with in terms of accommodation. So one thing we were talking about today would be that if there are, let's say in a classroom that there are 6 children that choose to wear a mask, that they could be in in a particular section of that classroom, so they would be together and you know, feel more comfortable that way. And but again, I think even with teachers that have some concerns, we're going to try to make accommodations for them. I think we'll do the same thing for students, but I think that has to be probably a one-on-one meeting with the parents, the child, and the administration. Yeah, I was actually talking to Laura McDougall today. She's the director of Four Corners Health, and she said it is very, very rare that you will have child-to-child transmission. It's usually going to be an adult at home that may give it to a child, or an adult in the community that's in that close proximity.
I mean, I guess one of the, and I uh, hate to answer, or I guess answer a question with a question. Um, Influenza poses as great a risk, if not more risk, every year to kids. But again, we're making the choice is being given to wear a mask or not wear a mask. Um, and I think it is valid to bring up other situations, And yes, we don't know, what this is, what the future entails for this. I mean, that's true of, you know, a lot of things. All we can do is what we can do right now according to what we know right now. No, yeah, that's true. Nobody is immune to it. Um, Again, we need to set the policies for where we're at and what we know about, our community. Um, to make it the best learning environment um, possible. Uh, you know, I mean, I think that when it comes to, um, you know, the children with special conditions, then those are questions that need to be answered on a case by case basis. Did you have something to?
I just wanted to speak briefly about kind of the general idea behind how we got to this policy for, particularly for St. Mary's. And so the, the social distancing, the hand washing, the masking are all part of the policy that we have. So we have the students spaced as best we can throughout the day, which does keep that distance between them. And at any point when we can't preserve that distance, then we do have them wearing masks when it's for that period of time. So that's how we came to this policy that's going to guide all of our activities during the day, and the teachers have restructured what they've done to make sure that we meet all of those things that we know will best protect our kids. I don't want you to think that we came to this policy lightly and that we just kind of thought, oh, well, we think this will work. Let's see if this will fly. This is months of losing sleep and worrying about your kids and my kids and all of them. I view them all as my kids. I say hi to them every morning when they walk in our halls. It's not a case where we just are not concerned and we're willing to put any one of them at risk. That's not the case at all. Every one of these kids is so important to us. And so we wrote this policy that we think best protects and provides a learning environment for every one of those kids. And we do believe that we're keeping them safe. I wouldn't put those kids in jeopardy, not on my watch. I'll do everything I can that I think will protect them, but still give them the best learning experience we can, because that is ultimately our responsibility as well. So and I worry about, the individual ones that we'll have to make special accommodations for, but we can do that. My goodness, we make accommodations all day long. We have kids pulled 100 different directions for every need that they have. That's what we're about. That we can do that. I'm not worried about that. I think that we'll work with parents and figure out what they need. But we had to have a general baseline that we thought would work for our kiddos. So I know that, and that's what Aquinas is, that's what they're based off of too. All this idea of what do we think is the best practice. We do. And, just even in the past, looking at things, I've been amazed to watch that when we know a case of the flu, for example, comes into the school and we go, oh, brace yourself, here it comes. Oh, the question was, are we going to have adequate time during the day built in for hand washing? So they are very tight, yes. so for example, a case of influenza would come in and all the teachers would kind of say, oh, we know we're going to see this one go, and it doesn't go to one more kid in the class. It doesn't even sometimes go within the family, and that's because of the amount of hand washing we have in place prior to all of this. So on top of that, we have increasing hand washing, increasing sanitizing, hands-free, touch-free devices, all of our faucets we swapped out, the soap dispensers, the towels. We've worked out ways to have the doors open so that there are just no common points of contact. We've wiped out everything we can out of the lunchrooms, any place where kids would have common touch, even though it looks like that's probably not the most likely place to spread. But yeah, so we do have a lot of hand washing time worked in. On a typical day, I asked the teachers, I said, in my mental thinking, this is when I see your kids washing hands. They said 5 to 6 on a normal, just prior to COVID, 5 to 6 times a day where they would be hand washing or sanitizing. And so the teachers are well aware to give them that time. And by the way, Hail Mary is just exactly the right amount of time it takes. So we were practicing that before we were out. The bathrooms are cleaned at least twice during the day, but again, we have nothing they touch. That's part of the cleaning process. So yep. So yep. And we don't have, there's no doors on, on the outsides that they would touch. And so, yeah, we've tried to limit all of those contact points. And Lisa. Yep, that came directly. So the question was, is the 3 to 6 feet as opposed to purely 6 feet? And that came from Laura McDougall at Four Corners. She gave a special advisory meeting to all the schools. And she said if we maintain 3 to 6 feet distance, no more than 15 minutes, if a student got sick with the coronavirus, then we would not have to quarantine any of those students who've been in that proximity because we've kept the distance. Straight from Laura McDougall. Okay. So the question was how we'll handle an exposure and what notifications we would make to parents. So the general idea there is, I think it's important for each of you to think right now, what if it was your kid? And so do you want that name on the Friday notes? Certainly no one does. And I think, I don't know about you, but I've lived in fear that my kid be the first one. No one wants that. And so first of all, we've got to kind of think about that dignity and then take the next step, which is what's to be gained if we share that information out to the students in that class. If we've met the requirements of the CDC, which is to maintain distancing, wear masking when we're too close, and have constant hand washing, then we would not have put your children at risk. And that's ultimately our goal. So what ends up getting published in that in terms of like number of cases per school or something like that, that will be probably determined as we go, I think. But
I think Four Corners.
The question was, would we release the name or release to the class that there was a positive case in the classroom?
We may not know it for some time because it's not at the doctor's office where they find that out, or we find it out. Somebody doesn't feel well, they go to the doctor, they get their test, whatever. Those results will go to the Four Corners Health Department. The Four Corners Health Department out of York will contact the school, well, actually, they'll contact the person, and they'll ask for contact tracing, to ask who it is, and they'll call us and ask us, do we know that this person was with a certain group of kids, thing like that. Now, I was tested last week. I'm sorry. I was tested last week. I had some symptoms. I went in. They said it's be best to be tested. I was tested Monday morning at 10 o'clock. And I received an email Wednesday at 3:30 in the afternoon that said the lab had received my results. And I didn't get my results until Saturday morning. So, you know, by that, all the rumors around David City, Dave McMahon's got COVID, it's terrible, and all this kind of thing had already run around. This is David City. I have to realize that. But it could take a week before we find out. You know, and the parents under no obligation to tell us. The health department will contact us if they need us for help with contact tracing. Otherwise, that's how we work. I mean, we're not going to hide anything.
The CDC or the health department said that if we can keep that distance, and we've worn masks whenever they're within that distance for 15 minutes, those would be what would be called potential exposures. Outside of that, there would not be potential exposures. And that's my goal. My goal is when Laura says, hey, we just got a call from this family that this child tested positive. Who have they had potential exposures with? My goal would be to say no one. And that's what I've conveyed to the teachers, that we've got to be very consistent about keeping that distance, keeping the hand washing, keeping the masking, so that we're not putting those other kids at risk. Well, when you look at their day, yeah. So the question is how to kind of contain that. Right. I mean, I think, so the question was particularly, you know, with littles or even older kids, you know, that they're not going to want to keep their distance and things. And it is true. I think what we looked at was we looked at the structure of their day and said, at what point do we need them closer than the 3 to 6 feet for more than 15 minutes? And for the elementary, it's reading group. And so our reading groups become that time that we're most concerned about. So in that time, we've made sure that we'll have masks available for the kiddos so that in the time when we can't keep them more separate, then they wouldn't. Their recess total time is 15 minutes. And so they would have to glom onto one child for like that entire recess time. We really did run through, we calculated their whole day and said, where are we going to have kids that are in that close proximity for that length of time around another child? We've mapped out their classrooms so that we know who they are near. So if the health department would push again and say, well, who was around them, that list is very small. We've got them snaking out of the classroom so that line order stays the same when they go to lunch, when they go to mass. So we know in the building, wherever they are, those are the only children they've been near. And so we really did kind of calculate their whole day and look at what are our risk points and how do we minimize those. We were actually really excited that we thought, so we're teaching them that it's more than your arm. You shouldn't be able to touch anyone. And I think that's going to cut down on a lot of other things that we've also been working on for quite some time. So I think it's going to be great.
I think an example from high school where our kids have already done a really good job is in the weight room. You know, just for the football team, for example, they really want to play football this year, and so they are doing everything they can to follow the rules when it comes to social distancing, sanitizing their hands. And I think them and other upperclassmen are really going to be our leaders in the whole school for making sure that all of our students are doing this the right way, because they want to be in school. And we will tell them that this is important, and you need to do these things because number one, we want to keep you healthy. Number two, we don't want you to have to leave school for 10 days. So you know, we want you to be in school. And so on the whole, as you guys know, we've got really good kids, and when we tell them something that it's important, 9 times out of 10 we get great response from them. And so I think that you know, they've been hearing a lot of these same things for the last 5 months, and so I think we have to give our kids a little bit of credit and respect, and knowing that they're not all perfect and they're all gonna, you know, we're gonna have mistakes happen, but on the whole, I think that you know, they will do what we say because they know how important it is for us to be staying in the school building. Yes. Right. So the question is, how are we going to explain to our children, our students, about what the expectations are here at school to stay clean, stay safe. Obviously, we're a K-12 system, so it's going to vary on how we present that to the kids. But I think in general, our teachers are really good communicators when it comes to that, and explaining it in an age appropriate way, not to scare them. When we've had to do intruder drills, you know, that's a scary situation, but our teachers have been really good about, you know, and better than I would, because I would be too blunt with them, but our teachers just know the exact right way to say it. And so I think we don't want to, you know, we want to tell them the important information. You know, you don't want to sugarcoat something, especially for the older kids, but I think just making sure it's age appropriate.
In most cases, when we have to say something to the students, we can't bring them together in the gym and do this. Okay, we're going to have to do this in the classrooms. Our kids are older than the St. Mary's kids, you know, and they've seen the news. They've seen parents' reaction. They've seen everything. But I imagine we would probably put together, and I see Mrs. McCorney in the back. She's kind of our guru on this. But we put together PowerPoints for our teachers to use in their classrooms on that morning, and saying, this is what we need to do. This is what we do together. This is how we can do this. And we ask for their help. We ask for your help. And we're going to learn through this whole year, just like you are and just like everybody else is. This is not something we're used to, and we wish we could give an answer that's going to make everybody in here happy. I just don't know what that answer would be. We're going to distance our classrooms. Our lunchroom is open tonight. You can go in there and look. Normally we could have 110 kids, 103. We've got it limited down to every other seat. Nobody in front of you, nobody beside you. Okay? Classrooms are going to be spread out as far as they can. I'm finding out today, kids are calling to do drops and ads. It's not going to be as easy as it was last year, because I have to limit the numbers of desks in rooms. So kids may not get a class they want until the next year. Okay, so things like that are changes we're making, but I know that all of our teachers are on board on trying to help with this. All of our parents will help with this. We have to give some credit to parents that they will watch for their kids' symptoms. We'll watch for the kids' symptoms. We have a protocol. If somebody is sick during school, when they come to the office, we take them to an isolated place. We call parents, we wait for parents to come home. They come get them. We don't leave them around other kids. We don't have other kids around them. Is it perfect? No, we're never going to be perfect here. I just, we're doing the best we can. We're telling them, instead of you got to be in school by 8:30 in order to be eligible to play or practice, because we don't want any Tylenol days, as Mrs. Zook refers to them, where the kids don't feel well. You give them Tylenol, you send them to school and say, try it till noon. Okay, we can't have any of those anymore. So now we're going to move our time to noon. If a kid doesn't feel well in the morning, they should stay home. Then we don't want them here. If they come at noon, if they're feeling better and they no symptoms and no fever, no anything, they come at noon, fine, they're still eligible to participate in whatever we have. We also before told them, don't bring backpacks with you and take them into the classrooms and do that because they're just clogging all the aisles and everything. Now we're saying, since the desks are so spread out, please put your whole morning in a backpack. So you don't only have to go to your locker once during the day, once or twice. But quite frankly, our kids go to the lockers more, and this comes back to just what it is, to either grab a drink of whatever drink they got in their locker, or food that they have in their locker, or check their phone. Okay? We have bus rules. Bus is going to be a problem for us. And I put the bus rules out today to the drivers and to the parents if you didn't get to see them. And nobody gets on the bus without a mask. Okay? And some of our routes are very, very heavily populated. Some are not. So the bus driver is going to make the decision. But when they get on the bus, they all have a mask on. When one bus leaves David City or leaves Aquinas, it's got 40 kids on it. Within 5 minutes, and the end of 11th Street, it's got 2 families left. If he says those 2 families that are social distance want to let their mask down, he can do that. Okay? But, in general, the buses that are really full like that either go right downtown here and get them off or go to St. Mary's. The rest of them, they'll assign them seats. The teachers are going to assign seats in their classroom wherever possible. We're spraying down the locker rooms. We're going to spray. Every kid that walks into a classroom will have to sanitize their hands when they walk in. The desks will be sprayed, and they'll wipe them off when they come in. So those are things we're trying to do. Can't say it's going to cure everything. And anytime, like if they're in science, our science rooms are huge. Our biggest class in there is 22 kids. They're spread out. So he's giving his lecture in science. He's asking questions. They're asking questions. Then he says, let's do lab work. Their masks go on. They're going to get together in their labs. Okay? I mean, even in Lincoln, they're scheduling mask breaks. Kids all have to wear masks, but they're scheduling mask breaks. Now they're scheduling school half time. Half the kids come Monday, half come Tuesday. Then they switch that up. They just announced that tonight. Our building was built for 400 kids in 1960. Since then, we've more than doubled the size of it. And we have 242. I think we can keep the kids distanced in school. Activities is going to be, tough for all of us. I'm more concerned about old teachers that are going to be 67 here this year and not always the healthiest guy in the world. I got 3 bus drivers over 70 years old. And if we do have a bus driver that gets sick, that route will stop until that bus driver can come back because they don't have any subs. Okay? So those are things we thought this out. And I really want to thank our doctors in town. Dr. Siepel's here, Dr. Witter, Jim Witter are here. And when they came and they helped us and they tried to make us feel comfortable, but I don't want this to fall on them. We're going to get cases up here. You know that, and I know that, and they know that. And it can't be, well, Dr. Witter said we'd be safe. That's not our intent at all. They gave us their best information they could. Father, Sarah, and I came up with policy. So it's our fault. Don't want any doctors blamed for this decisions or what we're doing. So, actually, me. I'm. It's different with COVID. We're going to have a special COVID thing that gets entered in there, so it's not counted as an absence. And for those people with special situations, because some of you do have them. We've dealt with them before. We will deal with them again. We'll work with you. We'll do what we have to do. Okay? Your kids come first, and we will do the best we can to provide for them. If you don't feel safe, you have to do what you think is best. And we try to help by doing that. But we're not going to just lump anybody together as a group and say that's it. Yeah. Band class is your concern. Yeah, I don't know that either. I know the band room's built for 75 students. We have 51 in the middle school band, and we have 39 in the high school band. And we'll go outside as much as we can with the high school. And we can go into the gym with the middle school. So we can spread them out that way. But as far as droplets through horns or anything else, Doc, I really... Oh, Helen's looking at filters for those things, and I mean, and our chorus classroom was built for 60, and our largest class in there will be 22. So we can spread the kids way out, as just like we spread you out. I mean, that's as best we can do here, I think. Really want to get rid of this, yeah. So, somebody's actually listening to our stream. This is good. Seniors will definitely get what they need to move on, not only just to graduate. They've already got what they need to graduate. Okay, they're required classes that they're put into, but they want to go into specific fields. So we'll make sure that they get into the fields they need. But if it's somebody who's a sophomore this year or a junior this year that wants to take a class from a grade above them, the senior would get first choice. And then we will limit the numbers in classrooms. And I'm sorry, what was the other?
Okay, so for St. Mary's drop-off, we've got outside, we're going to turn the lines where they normally stand. We're going to turn them the other way so we can really spread them out. And again, they're going to be that distance between every kid, and they're not going to love that. You know, they kind of like to glom in a big group in the morning there, but we've just got extra adults wandering around to kind of keep them spread out for that time period where they're waiting outside. When they have to come inside, we've got that same line order marked out on the floor with their names, so they learn at first, you know, where do they need to go, and they kind of have to be there. It's a shame because some of the things we had tried last year were really cool. Some walking in the morning and reading while they're waiting, and yeah, some of our cool things are sort of out this year, but I think that will help. Laura, I didn't really answer your question on temps, and so at St. Mary's we have been accumulating the quick read temps, and I know at Aquinas too. And so we were going to do a quick survey as the kids roll into the classrooms in the morning, just of, hey, who didn't get their temp today, and just a quick check. We were advised by the diocese not to take on sort of the legal liability of promising to temp check every kid on the way in, and so we won't be able to guarantee that we will get every kid, but we know the reality, and the reality is they're not gonna probably. I know my kids in the morning, good luck. Yeah, I'll be getting mine at school too, so that's how that will probably go. And there are 2 classrooms and the cafeteria set up to look at the spacing. Laura. Yeah. It does change often. Yeah. Just when you look at that plan that's on there too, just know that where we're starting currently, we're going to be updated every Friday from the health department. And so on those, they'll tell us, you know, what color they recommend us to be in. Right now we're in kind of the yellow. And so in the yellow column is where we have the masking just when we're within those distances. But if it doesn't work out, you know, if cases really break out around us, we've got those backups. You know, we do have stages that we can go if we need to. So our hope was to try to start in the safest, least restrictive environment we can to get education going, but knowing that we do have options in either direction. And we did include the green column on there, hoping that we can find normal again, you know, at some point here. So
I will say too that you know, a positive COVID test is not always a bad thing. All right, we need herd immunity. In order for all of us to get through this, we need herd immunity, and the closer we get to, and they calculate that be anywhere from 70 to 90%, the closer we get to that 70, 90%, the more protected are the immunocompromised, the elderly, and all that kind of stuff. You know, so I want to kind of bring a positive note to this, and all the positives that we hear in the United States and all that kind of stuff is not necessarily bad. You know, because usually those, as Dr. Witter said, usually those people are doing pretty well, and the kids are doing well, and even older adults that are healthy are doing well through this. And so we get closer to that herd immunity, and we get through this pandemic, you know. So I just want to bring that up too, because I think we kind of look at the downside of things, but we got to look at the positive side of things as well too. So anyway, I just had to kind of through all this, you know, and I know there's individual cases and everyone's concerned with that, and I think that's great. But on the other hand, I hear time and time in the clinic that we need to get our kids to school. We had a rough couple months, you know, at the end of school, and we really need to get through this. And I think if everyone's become a COVID expert, you know, through this whole 4 or 5 months, and you know, if we can look at both sides, and we can kind of come in the middle, and with exceptional cases, we make some, what do I say, you know, some, you know, accommodations for those. I think we'll get through this very well, and more importantly, our kids will get through this very well. So.
Mr. McMahon just brought up a good point too, that in our teacher training, we have a couple of really big initiatives that we have worked on for this year. One of them is a social emotional learning program that will go actually from infants at Holy Family all the way through 12th grade. And so once a week, it's a lesson just on dealing with, the stress, the frustration, gossiping, whatever the issue might be that pops up at that particular grade level. And I think that's going to give kids a great opportunity to sort of de-stress, deal with the struggles that they're having, help cope with their peers a little bit better. I know at the elementary level, our conversations start off on that first day with, hey, some kids are gonna want to wear a mask at this point, some are gonna want to wear it at that point. We're all gonna wear them when we go to reading group. They're gonna be on and off, and that's just how it is. And we're not gonna worry about what anyone else is doing. It's up to each kid to deal with that based on their level of concern. So I think that social emotional learning piece is gonna be fabulous. And the teachers were really excited. We had a trainer, Sister Janelle, come up from North American Martyrs. They've been using the program for several years now. It's called Choose Love. And so it's just about getting the kids to change how they respond in different situations. So I think that's going to be a very valuable piece. Plus, if we did end up, if things go from bad to worse and we ended up in an online environment again, we are certainly much better prepared for that. And so the teachers will have even more training before school. They've done some this summer just on being able to provide high quality online instruction, and more than we could do punting when all of this hit back in March. And so just know that we're preparing for all the worst, and just praying that our steps today take care of what we need so that we don't ever have to use them. As far as I know, our groups are 15 minutes. Now there are a couple. Lisa, I've got to work that out with the teacher. I'm not sure which one you're thinking of. They've all told me they're 15. Well, I mean, obviously I'm not going to have a teacher who says, well, 14 minutes, so then we wouldn't have to. I mean, I don't think anyone's going to push those guidelines. They all know what the intent is. So.
Reading groups, they put their masks on. For the last 15 minutes, the last 20 minutes, and the last 10 minutes, when they get out of the reading group, they distance again.
Some of the groups have been able to, some of the classrooms have been able to spread their kids farther when they do that reading group. And so if they can maintain distance, yeah. Sure. And they're absolutely going to be, and let the teacher know that's the case. And that teacher can also kind of remind them too. Yeah. And if they cross over those lines, then they absolutely will. So in classrooms where they can keep that distance, if they can preserve the distance, then they wouldn't have to wear them. So if you've got a reading group of 5 kids, because most of our reading groups break out pretty small, if you've got a reading group of 5 kids and space in the back of your room that they don't have to be within 3 to 6 feet of each other, then they wouldn't have to have the mask. I mean, that's our guidelines from the health department. But anytime we break that, then they know that they'll just mask up. And I don't think it's not going to be a contentious thing with the teachers. They've been very cooperative and very supportive in what we're doing. They're just looking for the best way to teach the kids. Right behind you, Tina's got the tightest classroom, and I think she's got it worked out. So she's spread wall to wall and front to back, and they did tell me to remind you that they're super excited to see your kids. So I actually had a couple of them today say, when we let out this spring, I thought, boy, do I even want to do this anymore? And they said, once we saw kids come around this summer, they said, remind the parents that we were super excited to see them come back. So that's where they're at.
We've been having some summer classes at the school. Has there been any issues as far as with the kids that have come in and out? I know we do temp checks as soon as they come in and they can't left whenever it's been budget weeks?
We've heard nothing. So the question was, have we had anything in the summer camps that we've had? We started summer camps early June, mid-June. So June 20th, I think. And yeah, at that point, we haven't heard anything. She did not. She just gave that. It was the kickoff call for all the schools in the Four Corners Health Department region. They had the administrators from all the schools on the call, and she laid out what the guidelines would be, how quarantines would be handed down.
I don't think the Four Corners is on an island. I think the Four Corners Health Department, works with, they meet with health departments all over the state. So I'm assuming that's, maybe it's a wrong assumption, but I'm assuming that's what came through the health department. And 3 to 6 feet was, I think that's pretty much standard across the state. I checked with a lot of schools west of here. Okay, a few east of here, not getting into Omaha, but getting to Gretna, getting to schools, in our area, but also schools west of here where our spread is, Butler County has the least spread right now of any of the 4 counties that Four Corners deals with. But when they get out farther, there's much less spread, and they're all trying to deal with this for their specific location. What I'm hoping is that Four Corners is flexible enough to let Butler County at some point possibly stand alone if York would have an outbreak in their county and they would go to Orange there. Does that mean that Butler County has to go to Orange here? I'm hoping that's not the case. They hope they don't just lump us all together all the time. They would hopefully deal with our medical people in town. Yes?
Out of curiosity, how many cases push it into Orange?
I don't know that. It's got to do with hospitalization, number of tests, availability of tests, hospital beds available. There's 5 categories, number of positives, and one other thing. And they at 9:30 every Friday, she gives a Zoom meeting with every school in the counties and says, we are in yellow, we are in, if we go to orange, masks become much more prevalent. Distancing becomes much more, important to us. We have to watch closer. We need to do better. If it gets to red, that means the governor or somebody came out and said the schools are closed again, teach them at home. So we have to go to online learning. I hope that doesn't come this far. I hope it stays in the bigger population areas.
If I remember right, a bunch of her rankings were more about the rate of increase and not necessarily number of cases. So it's more about watching what the trend is looking like.
Well, if there's no other questions, like I said, we'll say a prayer, and then afterwards, if you'd like to go look at the cafeteria and the classrooms, you're more than welcome to do that too. So again, like Dave said, I want to thank our medical professionals for being here tonight to help us, and again, thank you for being here and showing your care and support for our students and our school community. In the name of the Father, and of the Son, and of the Holy Spirit, amen. Glory be to the Father, and to the Son, and to the Holy Spirit, as it was in the beginning, is now, and ever shall be, world without end. Amen. In the name of the Father, and of the Son, and of the Holy Spirit. Amen.